friends, my name is Dr. Amit. I'm going to show you 3 different techniques of hair implantation. Hair implant करने की 3 different techniques दिखाऊंगा मैं आपको, and I will tell you which is the best, because I see a lot of videos coming from Dubai and from many places. They use one particular technique which मुझे लगता है is not a great technique of implantation. I'm going to show you why, and you can judge for yourself that this technique should not be done. So the first technique is where we hold the graft from the top. So focus कीजिए. So this is the graft. It's a single follicle graft. The root is here. This is the top of the skin. We hold it from here. So the root is absolutely safe. We open the hole and just put the hair in. The direction is already made. It's pre-slit. So पहले से ही हमने इस direction बना रखी है, and so I'm going to show it again. So your root is here, and ऊपर से हमने पकड़ा है. We open the space and gently just put the hair in like this. So this is how the hair keeps going in. This is one way of implanting. The other one, which is my favorite way of implanting, is to hold the root from below. So for example, this is the hair root. We hold the root from below by taking hold of the fat. इसके नीचे थोड़ा सा fat होता है, उसको पकड़ते हैं हम लोग, and then we open the hole and put the root in. So I have found this technique to be much more useful compared to the first technique. Especially if the grafts are very big. So 3 or 4 follicle के grafts अगर होते हैं, so this technique is much more useful compared to the other techniques. So you can hold it from the fat, just on the undersurface. So we open. And we just put the graft in. Now there's a third technique in which the implantation is done with one hand. एक हाथ से की जाती है, 2 hands are not used. So for example, I'm using this to open the hole here. It makes it much easier to actually put the hair in. So what is done in the third technique is, graft को ऐसे पकड़ते हैं and it is forced inside without opening. So यहाँ से पकड़ा graft को and it is brought near to the opening like this, and it is then forced inside like this. So I've seen this technique. It's not a good technique in my view. It is much better to open and then put the graft in. So मैंने technique बहुत बार देखी है in a lot of clinics in Dubai. They do it this way, and personally I never recommend. आप ये देखिए, this is with one hand. I'm bringing it close and I'm trying to push it in. So I've never been able to actually do this technique, but you can see that it is much more difficult to hold the graft and try to push it in with one hand. The best technique in my view perhaps is to open from here, hold the graft from the top and gently just push. It is also much faster, saves the grafts and creates a 100% result. See, this is how the graft goes, and particularly for thinner grafts, hairline, it is much faster and a much better technique.